Let's get into our discussion now. The Abuja Declaration of 2001 recommended at least 15% of the budget to be allocated to the health sector. But in the past 2 decades, Nigeria has fallen short of that figure. And this year's proposed budget, due to be signed into law, is no exception. Nigeria's health sector continues to groan under the weight of many challenges, ranging from the lack of infrastructure, obsolete equipment, brain drain, non-existent health facilities, and hard-to-reach communities, the fourth wave of the COVID-19 pandemic, among others. But how can the country ensure an overhaul of its health sector in the new year? That is the big question we're asking as we pip into the new year and see what it holds for everyone. So joining me on Zoom is public health physician Dr. Obinna Ibirim. Dr. Ibirim, good morning and Happy New Year to you.
Good morning and Happy New Year.
Great. Now, we have been talking about the revamping of the health sector, and when we also mentioned the Abuja Declaration, where African countries met in Abuja, coming into an agreement that there has to be something drastic to be done, and there has to be at least about 15% of the annual budget to be allocated to health, so that it can help standardize the living of people and helping people when it comes to their health needs and health and medical needs. How far from that target are we as a country?
So, thank you. First of all, I would say that we have not reached that 15%, despite inviting other heads of state to Nigeria to reach that declaration. And it's also unfortunate that some other countries like Rwanda and other smaller countries have achieved this, and Nigeria have not achieved this. And we have seen this in the health outcomes. We have seen this in the quality of service delivery. We have seen this in the poor remuneration of health workers that have led to brain drain. So we have the maximum we have done has been about 6%, which still falls way below the 15%. And this year, based on the approved budget, the 2022 appropriation bill, I think we're doing 4 point something, even less than 5%. So I think that this is poor, this is unacceptable, and our leaders need to prioritize health by putting their money where their mouth is and allocating more to the health sector.
All right, now, for the sake of those who may not have a clear understanding when it comes to, when we're talking about these figures and how the medical or the health sector should change, can you paint a picture for us of if the 15% is actually allocated to the health, 15% of our budget is actually allocated to the health sector, what would it look like? What is that dream? What is that benchmarks that we would have seen in our health sector if that is done?
Okay, so I'll give an example. If you look at what they call pillars of the health system, so if we achieve that 15%, what it means is that we're not just going to have structures that are ill-equipped, that are manned by a health force that is not motivated. We're going to have infrastructure, which is already what most times the meager allocation is used for. But then we're going to have equipment. As a medical doctor, I won't have to guess. I would have the endoscopy I need, the amount of the size of scope I need to make appropriate diagnosis. And then we'll be able to cover the vulnerable. The health insurance coverage will be higher, such that the vulnerable would have access to health care without suffering financial hardship. The health workforce will be well motivated, and we would be able to retain more of our doctors, nurses, and then we won't have the brain drain we're having today. There'll be more research and development, so that at this time we might be producing vaccines and some drugs that we spend a lot of money importing from other countries, and at more even worsening our economy, because then we have to buy those vaccines and drugs in dollars. So that is what more allocation to the health sector means. It means that Nigerians would be able to access quality health care at a cost that they can afford without suffering hardship. And what it means in the long run is that the health outcomes will be better, because if they have more access, they will be treated, and then they would not, the mortality rate, that is how more people die, would be less, and would basically enjoy more health outcomes. So that is the picture of what it means if you allocate more to the health sector. But then beyond allocating more to the health sector, it's also the need to be efficiently manage those resources, because there have been cases where even the meager allocation has not been completely drawn down and used effectively. There have been cases in the past of corruption in the utilization of funds. So it's important that as we, as health professionals, request and plead and advocate for more allocation to reach that 15% declaration, we also should, as managers of the health sector, ensure that the resources we have are efficiently managed to ensure that we deliver adequate quality health care to our people.
All right. Now, we have always had shortfall when it comes to investment in the health sector, and the coming of COVID-19 is said to have, made great contribution on the negative to the impact on health. Can you make us understand how COVID-19 has impacted or compounded the situation in the health sector?
So the impact of COVID-19 can be said to be positive and negative. Now, I'm going to go a bit about the positive impact, and then I will then go on the negative impact. Now, on the positive impact of COVID on the health system, we have, during COVID, we saw that there are opportunities to mobilize more resources for the health sector. We saw the network, I think in the COVID, that we're able to come together and donate so much for health. Now, these are opportunities that we can tap on to ensure more resources to the health sector. That's the positive impact. And then I think also that there is now a greater realization of the importance of health and health security in the minds of our policymakers. And we need to leverage on that to begin to advocate to health policymakers to say health is very important. If the health goes wrong, it affects all facets of the economy, like we saw with COVID. So these are the important parts. But then on the negative impact of COVID on the health system is that there was a huge strain on the health system. It exposed the weakness. We see that during the COVID-19, most of our health facilities could not absorb the amount of health needs of the people at that period. And some people even died, not because of COVID, but because of poor access to their drugs and the health service delivery that they need. So, but then amidst all this negative challenge, and then also it was a strain on the meager resources. So we had to allocate more funds to procure the COVID-19 vaccine, run a vaccination program that ensured that a good number of Nigerians are vaccinated. So there was also a strain on the meager resources available to the health sector, and it also exposed the weakness in the health sector. But more importantly, beyond this impact, the positive and negative impact is how do we leverage on the COVID-19 pandemic to strengthen our health system? And some of the things we need to do is to understand that, first of all, health is wealth. Health affects all facets of the economy, so we need to appropriate more to health. Secondly, we need to begin to invest in research and development. We shouldn't rely 100% on foreign drugs, on foreign vaccines. We need to produce in what we saw the vaccine nationalism inequities that occurred during the COVID-19 pandemic. If we had our vaccine manufacturing plants here, we wouldn't have bothered so much about the shortfall globally. So these are the opportunities. And then we also need to invest more on health security. How do we protect our borders from such outbreaks, right? So these are the opportunities. These are the opportunities we need to see and then leverage and make sure we strengthen our health system. And then also make sure that our health facilities and the health system is able to withstand such pandemic when it occurs again. So these are really the lessons we need to learn from COVID, and then make sure that we are ready for the next pandemic or the next outbreak.
All right. Now, let's talk about the issue of brain drain. Recall last year in 2021, a lot happened in that regard where we had reports of outright recruitment of Nigerian doctors in parts of Abuja and other parts of the country, where doctors were leaving the country in droves, who were already gotten or who were already given some appointments in some medical facilities across some countries in the world. And that, sent shivers across so many people who felt that we don't have enough doctors. And for the ones we have to leave, and they're leaving in that number, it created some level of panic. Anyway, there was a way to manage that according to government. But talk to us about this. So if we have to reverse that, because that is what they call the push and the pull factors and all of that. I know that it is just a given that if we have all of these things in place, we will have our own pull factors into Nigeria from other places. But when it comes to deliberate and intentional steps to reverse this trend, what should that be from your perspective? You are an insider, so share that with us.
So just to say clearly that the brain drain is real, and I don't blame my colleagues so much, because there's a lot of factors that cause this. So the first factor, I would say the more like the internal and then the external. Now the internal factor is the funding. The funding is poor. We've talked about it. Let's not overemphasize on that. But the impact is that the health workforce in Nigeria are poorly remunerated. The lack of access to health insurance and the financial hardship means that sometimes doctors have to help out of empathy some patients. As a health officer so many years ago, I remember even contributing to help some patients who have been held back because they cannot afford to pay their bills and get discharged. So that's frustrating. That's about funding. If you have adequate funding, which means that more people are covered, especially the vulnerable population, and you're paying your health workforce well, it means that you are taking care of that factor. Another factor is due to the poor funding and also the mismanagement. Our health facilities are poorly resourced. They have poor infrastructure. Just before the Christmas, I took my son to a procedure that couldn't happen in a private hospital, a public hospital, tertiary hospital in this country. I don't want to call names. And I was very, very disappointed. Now, as a doctor, I was feeling the pain. Most of the tools you need are not in the hospital. You have to buy almost everything, up to your gloves you need. Gloves. It was so disheartening. The surgery that was done, the surgeon had to bring his own personal equipment because when the one in the hospital was used, the outcome was poor. So as a doctor, as a medical practitioner, you know how frustrating it is when you want to do your work and you don't have the adequate tools. So that is a factor. So then if you talk about these are about internal factors that we medical practitioners feel and makes us frustrated and want to live to where we can practice, not just have more with dignity, but also have the tools we need. Then on external factors, as medical doctors, medical practitioners, pharmacists, nurses, we also have a family. And then if our family are living in a state of insecurity, you have had cases where doctors are target of kidnap, right? And we cannot afford, based on our salary, to take our children to the private universities and the public the private schools, and the public schools are not up to standard. Then that is also another level of frustration. So when you hear that people are leaving this country, it's not just about the funding, but it's also about some of these external factors and some of the frustrations they feel when they work in the health facility. So what can we do? What can we do to stop this? It's just to reverse some of these factors I've mentioned. So we need to improve on health security. We need to improve on our education on the external front. Then when you go internally, you need to fund the health system well to ensure that, first, your health workforce is well remunerated. Secondly, most of the vulnerable patients are covered with health insurance. Thirdly, the management of the health facilities at the tertiary, secondary, and primary level needs to be improved. In the past, we had the drug revolving fund, we have the funds for departments to procure. We need to manage our health facility. It's not acceptable that a patient should be buying gloves and some of these things, that consumables that should be in the hospital before a procedure is done. And with those delays come increased mortality and morbidity. So we need to get our management right. We need to get the funding right. We need to get the remuneration right, and the external factors, we need to get it right so that doctors can practice, pharmacists, nurses, and other health workers can practice their profession with dignity and not live for greener pastures. If we don't do that, it's a natural law of nature. People are naturally going to be drawn to a better life, no matter how much they try to resist it because of patriotism. But over time, they will just get to be pushed to the wall and they will bounce back and then exit this country. So these are the things we need to do, and they are doable. It's all about leadership. If we get it right, we will then reverse the brain drain and the exit of health professionals out of this country.
All right. We just have a few seconds, but let me just ask you this before we go. The point there is, when it comes to private sector participation, this is what everyone calls for sometimes, especially when it comes to issues of management and the quality of service and all of that. In the health sector, where it is obvious everyone is complaining of the fact that we don't have enough, but we don't seem to have a lot of influx of private sector investment in the health sector. Why is that?
So, you know, the private sector, they are business people. They want to go to where they can see an efficient management of their counterpart resource, and then they would see a profit, or it might not just be in cash, but the outcomes will such that they can see the return on their investment. So it's something that the managers of the health system need to make more attractive. We need to sell health in a manner that it is attractive to the private sector. And as I mentioned earlier on, there are opportunities to leverage with the COVID-19 pandemic, where we saw that we didn't have to preach, we didn't have to advocate the private sector. It was glaring with the impact of the COVID-19 that the health is very important. It affects all aspects of the economy, including their businesses. And then they had to invest so much to see to the end to the pandemic. So now that it's not like the pandemic is over, but as the pandemic winds down, or even now, we need to then begin to leverage on that to sell to the private sector, to say health is very important. It will affect your business. There are return on investment in terms of health outcomes and others if you invest in health. So it's about making health attractive and advocating to the private sector. Once you do this right, the private sector will get in terms of investment, in terms of I would say return to the communities where they work in. The net effect is that there will be more resources to the health sector, there will be more collaborations, and in the long run, you will see better health outcome and better investments in health. And some of the areas that there are gaps today in terms of maybe research and drug and vaccine development, you will then see an improvement, because some of those areas need a greater involvement of the private sector. So it is this is a call to action for us to advocate and get the private sector more involved.
All right. Thank you so much, Dr. Obinna Ebirim, for your time on the program. We appreciate you.
You're welcome, and Happy New Year to all the viewers.
Yeah, thank you, and you too.